Hi everyone, Farmington Mayor Nate Duckett. Thank you for tuning into the Mayor's Table. Today we're going to be talking to two local healthcare providers regarding COVID-19, answering frequently asked questions and going over the numbers of where we're at today. Everyone, Farmington Mayor Nate Duckett. Thank you for joining us for another episode of the Mayor's Table. This is a special episode because we're doing a community update on COVID. Kind of looking at the numbers, things that are happening here locally, things that are happening at Salem Regional Medical Center. With me, we have two friends of the show, so to speak. Both have been here before. We're very grateful for your service community and welcome back to the Mayor's Table. We have Salem Regional Medical Center Chief Medical Officer, Dr. Robert Underwood. Nice to have you here.
Thanks for having me.
Yes, sir. And then we have our nurse practitioner, Rita Abood, with the New Mexico Department of Health.
Hi, great to be here.
Well, it's great to have you back.
Thanks.
So I think it's just important at this time to have a kind of a community conversation here, talk about things that are happening. A lot has obviously transpired since the last time we've had. I think Rita was on here with Dr. Pope the last time we had an update on COVID. Mm-hmm. We talked quite a bit at that point about vaccinations. And a lot has changed now because we've gone through a phase where I believe we're nearly 80% vaccinated here in the state of New Mexico. Dr. Underwood, is that correct?
It's definitely in the high 70s.
Okay.
Yep.
Which is great. I mean, that's what we've been pushing for. I think from the standpoint of at least my office, we've said, look, people need to make a personal choice. What's best for you, what you feel most comfortable with, where you feel safe. Go make that choice and have those conversations with the people in your lives that you love. So we've come a long way since then. Obviously, the Delta variant has thrown kind of a wrench into the system, so to speak, and it's caused a lot of concerns. I mean, not just here in the state of New Mexico, the entire nation. I mean, you can look across the globe where they've been dealing with the Delta variant. It hit there earlier than it hit us, and we're learning a lot from those things. And so wanted to make sure we provided this opportunity for you as health professionals to talk about the things that you're seeing, things that we need to continue to do, and obviously with the hope that we continue to make good choices here as a community to support each other during this time. So, Dr. Underwood, I wanted to kind of start with you because there was information that came out from the governor's office regarding what many have called the vaccine mandate for healthcare professionals. I did a little spin on that here earlier in a conversation because you could really look at it as a testing mandate with an opt-out option to be vaccinated. So the schools, for example, are requiring anybody who's not vaccinated to be tested. So everybody who's not got the vaccine, they're going to have to be tested weekly. And the hospital and the schools are both providing services for those individuals who want to be tested to do so there. Is that correct?
That is correct. And yes, the mandate that has come down, tomorrow is the date that it all has to be implemented. It came out on the 17th, and there were 10 days to enact it. And so we've had this very similar conversations as what you indicated with our providers and our caregivers who have not yet had the vaccination. There is also an exception or waivers that our providers can get, and then they would, if they are granted the waiver based on deeply held religious belief or a medical condition, then they would still be tested on a weekly basis.
And I think it's important for people to know, we know the schools are allowing, I believe Curative is there on site in a number of facilities to help people facilitate those tests in a fairly timely manner. But as I understand, the hospital is also providing time to each employee to go and get those tests done, and some tests are also being done in-house.
That's correct. We have the capability of doing some testing in our facility, as well as giving the vaccines, obviously, in our facility. But there's lots of availability for testing within the community, and there's lots of resources. We recommend that if you, outside of just doing the regular test, if you feel like you need to be tested, that you really contact your primary care physician. Don't just come to the hospital and expect a test at that point. And Rita probably knows more about that than I do in terms of the community capability.
Sure. And I do want to get into that, Rita, talk a little bit about where people can be tested, kind of that kind of thing. I do want to make sure, I want to touch on this point real quick because we're talking about the emergency department, and you made a great point there. If you're feeling sick, the emergency room is not the first place you should go. It may be the place you end up going, but it's not the first place you should go. But it seems like there's been an uptick in number of visits here, over the past 30 days, not just in our ED, but also, in other hospitals. And I'm not sure what's driving that, but I think it's important that community members know, again, as we've talked here on the show, if you're feeling sick, your primary care physician should be the person you contact first.
Absolutely. And yes, you're right. Almost all of our kind of walk-in type facilities, urgent care, the emergency department, we've seen an almost astounding increase in the number of people that have been coming in, especially over the last week or so. And I am in discussion with physicians at all of the local hospitals here in the northwest part of the state, and they're all seeing the same thing. So yes, the first step really needs to be call your primary care physician and get their advice on what you ought to do, rather than just coming into one of those walk-in community areas.
I mean, as much as we want to have as many, ED professionals ready to serve, we are limited in that scope, as every hospital is. So we definitely want to, and then we got to prioritize who's getting those health care first. But Rita, let's talk a little bit about the testing. I mean, you've been on the front lines for testing, and then it kind of transitioned into vaccinations, and then, and now what are you juggling with now?
So I will add that all state employees are also facing the mandate for vaccine or testing. And so that's something that, those of, my coworkers and I are also dealing with, and all state employees. And so those who are choosing not to get vaccinated and are needing that weekly testing, in our community, Curative is still out at McGee Park 6 days a week from 10 to 3. Offering testing there. The state is also pushing a company called Vault, which also offers free at-home surveillance testing. So you can go to the Vault website and order a test. It gets shipped to you at home. You can do the test, and then you ship it back to Vault in a prepaid, pre-labeled package, and then you get your test results that way. Of course, you do need, internet access, and I think you are required to show an ID or have a valid ID in order to complete that testing. But that also is free testing, as is Curative. Since the start of school and the vaccine or testing mandate for the schools, Curative has also set up some pop-up sites, both in Farmington and Aztec. So 3 days a week, they're out in Farmington from 7 in the morning till 3 over at the central offices. Then twice a week, they're out in Aztec at Cook Stadium from 7 to 3. And while those are set up to kind of facilitate surveillance testing for school staff, they are open to the public. And again, that is free testing. No insurance is needed or anything like that. People can just kind of show up and get their test done.
I want to make sure I clarify. You've used the term surveillance test now. So what do we mean by surveillance testing?
So for surveillance testing is this ongoing weekly testing, people most
That's
likely
what
have no
they've labeled
symptoms.
it surveillance testing.
Exactly.
Correct. For our caregivers, if they qualify for one of the waivers and opt not to get the vaccination, then they have to participate in surveillance testing once a week, show that they're still negative. And all of those options that were just mentioned are available to our caregivers at our facility in order to do that.
And the word free is important because I've had pushback on this word free. So I make sure we clarify it is free to you if you go and tell them you need the free version of it.
All of our specific requirements actually go into effect on Saturday. So
The
28th.
Got it. Okay. I want to make sure I saw that.
You bet.
So for the individuals, my wife is a nurse at San Juan Regional Medical Center. One of the concerns we had, obviously, in different articles that I've seen come across the wire, just in regards to the current status of staffing in hospitals all across the nation, probably the world. We've seen just because of the impact of the pandemic, I think the impact of travel nursing, the impact of early retirement. I mean, these kind of things we're seeing a decrease in the number of staff we have. And this mandate came out. It touched on me because I have a wife who I want to make sure there's staff to support her in her own job. But more importantly, as a community member here, I want to ensure that our level of health care doesn't drop off because individuals no longer feel like they can work for our health organizations. And so I just want to take a moment to encourage people, whether you're working for the state, the schools, the health department, let's try and work within the system as best as we can because we need you. We need that staff out there. We need you in the hospitals. We need you in the emergency rooms. We need you in labor delivery. We need you, anywhere that there's going to be somebody who needs immediate care, we have to have staff there to do it. And we don't want to put ourselves in a predicament. And I know these things aren't easy, but we can find ways to work through it, just like we've done for the last almost 2 years now. I guess I don't want to get ahead of myself. Maybe it's 18, 20 months. But still, we have found ways to work together through this successfully. However you may measure success, but I think we can continue to do that now, even though times may seem tough. Let's keep going.
I really appreciate you saying that, Mr. Mayor. It cannot be overemphasized, and support from our public to our healthcare givers is really absolutely essential. We greatly appreciate the work that they have done. And there is not a call that I am on, whether inside our organization or statewide or nationally, where a discussion about staffing capability and the crunch that people are under right now doesn't come up. And so, working together is absolutely imperative, but also appreciation from our public for the work that they're doing. After the last big wave, we really thought we were kind of getting onto the other side of this, and this is having an impact on some of the emotional components of those that are facing another surge. And so thank you for bringing that up, and we do appreciate our caregivers more than you can imagine.
Well, I know there was an outpouring for a period of time, certainly January, February. We saw a lot of organizations and businesses and volunteer groups, and they were bringing meals to the emergency room, or they were doing those kind of thank you cards and those things. I really think right now is that point where we need to keep doing that.
Yeah.
We need the community to come out and say, look, everybody's under stress. We're counting on you, and we need you there. And just know that we appreciate everything you're doing. And so I would encourage our community to continue to find those ways. And there's creative and uncreative ways to do it. But let's just make sure we're patting them on the back and thanking them for the service in the best ways that
Absolutely.
we can.
I just, wanted to throw out our core staff in our office is 5, about to go down to 4, that, collaborates and coordinates the vaccine clinics and previously the testing. And so I just wanted to throw a huge shout out to our Medical Reserve Corps nurses who have stood by us for over the past year and a half with testing and vaccination, and also all the other volunteers who stepped up to make all of those clinics possible. We really couldn't have done it without them. So we are a really small staff, and we're hiring. So
as is the hospital.
Oh, yes, we are.
And the city of Farmington is also hiring police officers, firefighters.
So,
you name it, we're looking for it.
So we really appreciate support from the community and our community volunteers.
Awesome. Thank you for that. So let's get into some numbers. This is airing on Monday. Today's the 26th. Just for clarity for individuals, we want to make sure we provide accurate information to them. As of this morning, when we were talking about surges, there was a point during January. I want to say we had. What was the high? Well, let's just say, what was the highest number of COVID positive patients that we had?
So actually, combined, so we treat those who are positive and those who are waiting for the test to come back as if they're positive. Yep. And our peak was literally exactly 100.
Yeah.
That was back in January.
What are we looking at here today on the 26th?
So as of this morning, we had 32 positive and 4 under investigation or waiting for that test to come back. So a grand total of 36.
Okay. Out of those 36, how many are intubated?
So currently we have 6 of our COVID positive patients that are on a ventilator.
Okay.
We have a total of 12 patients at the hospital today that are on a ventilator, so half of them are COVID.
Okay. And if we're trying to gauge what many are calling the vaccine efficacy, I think is the right word there, how many of those individuals are we able to keep those local stats of those who are positive and been hospitalized? How many have have had the vaccine or have not?
Yes, we are keeping track of that. As of last week, which is the last time we actually ran the data, we were at about 16% of our inpatients that were vaccinated, which
Okay.
leaves 84% of our patients are the unvaccinated folks. When you consider what you said before of how many people in our community are actually vaccinated, the vast majority of them are vaccinated, but the vast minority of our hospitalized patients are vaccinated, which does show the great protective capability of the vaccine in preventing hospitalization and preventing ICU.
And just
Rita has some other numbers on that too.
yeah, so statewide, throughout the state, we're seeing about an 8% hospitalization rate for vaccinated folks and a 92% hospitalization rate for unvaccinated folks. So a little bit different than San Juan County,
Interesting.
but still highlighting the fact that it seems as though the vaccine is highly effective at preventing hospitalization.
Absolutely.
Well, that's good because there's a lot of questions out there about, how effective the Pfizer vaccine, we'll just say, for example, is against the Delta variant. And you can, I mean, that's the great deal of our age. I mean, for every, one person who says one thing, you're going to find another person who's saying another thing. But I think getting the local viewpoint from individuals who are dealing with this on a daily basis, I mean, for me, that's the most valid data that we can provide. So 16% of individuals who are hospitalized have the vaccine. So there's the breakthrough cases.
Sure.
Do we have any data in regards to deaths associated with individuals who may have been vaccinated?
I am familiar with one
Okay.
locally.
Okay. So, I mean, but out of all the numbers, that's a very small percentage still.
Yeah, very small.
Okay. And there are individuals who ask the question of, well, why then am I being asked to mask if I'm already vaccinated? And maybe to the point that there's 16% that are still ending up in the hospital. And that's 16% of a large number of individuals, by the way. It's a very large population that we're talking about. But, I mean, I guess the question I have to ask, because I'm somebody that when I got vaccinated, one of those main reasons was I didn't want to wear a mask.
Right.
And so now I'm being asked to wear a mask again. I'm not happy about it. I'm willing to do it, but I want to understand why. Maybe you could shine some light on that a little bit.
Sure. And so everything is a layer of protection. And as we just talked about, the vaccine, and no vaccine is 100% effective. Is it protective? You bet. It's very protective. But there's still that window where something can get through. And so to put another layer of protection on top of that gets you closer to 100% protection. Will we ever get to 100% protection? No, we're not. But every time we try to do one thing, we want to give it a backup, so to speak, so that we are improving our overall statistics of keeping people healthy within our community.
I'm glad you said what you just said. Will we ever get to 100% protection? And so one of the questions that resonates with me is, will there ever be a world without COVID? And how long do we go on with, I'm going to just ask the question, will we ever live in a world again without COVID?
This is getting a little more into opinion because I've really not read anything about it. I have recently read an article about variants and the anticipation there will continue to be variants. So that will probably continue for at least a while. How bad the variants will be and how much they surge, and we really don't know the answer to that. We would anticipate that it will continue to go down. Even what we're seeing now isn't anything close to what we saw back in January, as you referred to earlier. And we look at the eradication of disease processes throughout the world through vaccination and improvement of the vaccination process. Polio and smallpox are probably the two biggest that come to mind. So we'll continue to work that. How long it will take to total eradication, I can't even speculate the answer on it.
I'm going to guess to that point too, H1N1, swine flu, avian flu. I mean, those things, the hantavirus has been one that's been through this area, and there's times where that pops up again.
Yep.
But to the degree of, the impact and the populations that would be infected by that, I mean, I guess but it is a worldwide situation, so
Absolutely.
it's not just local.
Yeah, and there's all kinds of things that go into trying to contain and eradicate, come up with vaccinations for it, different things like that, and will continue to happen.
Sure. Rita, what other information do you have from the state that you could share here locally that would be good?
We can always talk about our vaccination rates here locally. So among our 18 and older population here in San Juan County, we're sitting at about 67% fully vaccinated, which is awesome. The state yesterday announced statewide that we're at about 67%. So we're
fully vaccinated.
We're fully vaccinated.
Okay.
So we're sitting right with the state rate. When we drill down a little more locally and we look at our pockets of our zip codes, we definitely see, that differential that we talked about the last time I was here is still there, still sustained. We are seeing kind of towards the west side of the county again, Shiprock, Kirtland, water flow being at a very, very high rate. And then kind of more on our east side, Aztec and Bloomfield, sitting at about 37 and 44% for our 12 and up fully vaccinated rates.
And those numbers have changed because now we're 12 and up.
Right. So
18 and up we were higher.
Right.
Now we're putting in the 12 to 18-year-olds, and so that percentage has come down.
Exactly. So I've actually been in discussions over the past few days with one of our epidemiologists, kind of just trying to drill down on what exactly is going on. Our rates are good, and then they go down, and then they kind of stabilize, and then they go down again. And basically they've been adjusting the denominator. So they started to add the 16 and olders, so that makes the total population a little bit bigger. And then as of this week, on the 22nd, they added the 12 and older.
Okay.
As part of the total population that could get vaccinated, which is why our vaccination percentages went down. So, in Farmington, 87402, and Flora Vista, and Fruitland, we're well over 50%, close to 60 and 70% vaccinated. So, we're doing pretty good. We're doing a lot better than some other parts.
Well,
of the state,
it's interesting.
for sure.
The other parts of the state that now, for a long time, San Juan County was. And we were number 2 to Bernalillo in positive cases. And I had an individual ask me, is that my goal as mayor to be, to have the highest positive? Yes, that was my goal. I mean, so now, though, if you look at what the vaccination rates are for the southeast part of the state, they're much lower. And you get Lee and Curry and Eddy County now that have come up quite a bit in positive cases. And I know in speaking with leadership in those communities, I mean, they're definitely concerned about what has transpired, and
Sure.
So we've kind of dropped a little bit further down that list, so to speak, and a lot of that has to do with what we have been able to do thus far, in my mind, with individuals making that choice to be vaccinated. But that's good information. Now, the next question that's out there in regards to the Pfizer vaccine specifically is the booster. Is there a third shot that's I know they're talking about it right now.
Sure.
And actually, I guess, Rita, they've already given the green light to some degree, maybe,
Yep.
for individuals of
Absolutely.
particular
Right.
situations that they could get that.
And so before we start talking about the booster, it's important to mention that Pfizer did receive full FDA approval for 16 and older now.
So it's not. So it no longer is emergency vaccine.
Right.
It is FDA approved.
Right, for
Correct.
16 and older.
Interesting.
So that, we're really excited, and we have seen a lot of, 16 and olders showing up with a little more frequency to our vaccination clinic. So that's really good. As far as the booster is concerned, and, Dr. Underwood, feel free to interject. But right now, the booster really is intended for those who are immunocompromised, and there is a very specific list of qualifications of what does that mean. For example, people who received a solid organ transplant, people who are under current treatment for cancer, things like that. It really should be a discussion with their provider if they do need that that second booster dose or that third dose. But we are administering it, and the state is encouraging other providers in the community to become COVID vaccine providers, since they know their patients the best and can make that shared decision making together in their offices.
That's correct. And for the last couple of weeks, we've been administering third doses exactly to that group of folks who are immune compromised. And yeah, the list is a little bit narrow in terms of who qualifies under that immune suppressed group. But we have been providing it, like I said, for the last couple of weeks for those who qualify. Another one that I would add are people who are on chronic oral steroids are included on that list as well.
But it is the same shot.
Yep.
Right?
Yes.
It's not changed at all because of a variant. It is the same shot.
That is correct.
So what does the third booster do? I mean, it just...
It reprimes your immune system. So without getting too much into the cellular level of how the immune system works, it basically allows certain types of cells to be reintroduced to what it sees as components of the virus, and be able to mount a response to an attack more rapidly. Over time, that immune capability starts to wane is one of the things that they're finding, and it wanes faster in certain groups of people, a little bit faster than it does in others, and that's really where that third booster recommendation is coming from. And this is based off science that we've seen evolving over the last I guess the first vaccine started back in December, so now it's September, and that's where people are starting to see that decrease over time.
One area that I don't see talked about very much is individuals who've had COVID and what their antibodies are doing. Are you hearing anything that you could share with us that might give some background to people to understand if you've had COVID, you could expect a certain amount of time of protection, but
so there is an antibody response to an actual infection. Research has shown that the antibody response to an actual infection is not as strong as it is to the vaccination, which is interesting, but it's great information for us to have. So whether you have had COVID or not, the recommendations for vaccine is not different.
Okay.
If you've been infected with COVID, there's still a strong recommendation for the vaccination.
Okay. Read anything else on that you're seeing?
No, I totally agree. They're encouraging everyone to get vaccinated regardless of past COVID illness.
Yep.
Well, I don't have a whole lot of other questions left on here, but I want to make sure we get anything vetted you want to make sure that you get out that the community should know.
So we do anticipate that the third dose, when we talked about the third dose that's available right now, the data that we're hearing coming out of the recommendations will be that the third dose will be authorized on September 20th. At that point in time, we'll be able to administer it to anybody. They are looking at 8 months past your second dose as the opportunity to get the third dose. We would anticipate that a lot of our caregivers are going to step up right away to get that third dose. We also understand that there'll be a big kind of campaign just a couple of days after that authorization comes through to really start encouraging it across the entirety of our country.
Okay.
And so to be clear, those who are immunocompromised, the recommendation is to receive that second booster dose 4 weeks after their first booster. And obviously, since that recommendation just came out, there's lots of people who got their second dose a long time ago. So they're kind of playing catch up right now. For the rest of us, for those without immune compromise, the recommendation is to wait 8 months after their second booster to get this, after their second dose to get their second booster shot.
Just in regards to vaccinations, people have asked me, just in the last couple of weeks, where can I go get vaccinated? And I'm always quick to say, well, you need to register online at the NMDOH website. Is that still the case, or can we walk in somewhere here in town?
So yes to both.
Okay.
So people are definitely encouraged to register at the vaccinenm.org website. of Department of Health. It kind of makes things quicker and easier when they show up to get vaccinated. But pretty much every retail pharmacy, as well as the hospital, and our office are offering vaccine on a daily basis. I know, for example, Walmart is also offering it on Saturdays and Sundays. And so it's really, really easy now to get vaccinated. You do not necessarily need an appointment ahead of time. You do not have to register ahead of time. It just makes things a little easier when you show up. I would encourage folks to call their local pharmacy if they can, before they show up, just to make sure that they're offering the vaccine that they're looking for, and that they are offering it at the time that they're planning to stop by to get it.
And are they still given, is it still Moderna, still Pfizer, and still J&J? Are those three still in play?
Those are the primary three that are available in the United States right now. The Pfizer vaccine is completely FDA approved now.
Right.
And so that's the one that has the FDA approval, but you can still get any of the above.
Is Moderna doing a booster or just Pfizer?
I believe that Moderna is also going to be doing this. Are you asking about the
Yes.
second booster?
Well, the third shot.
The third shot.
Yes.
Yeah. Yep.
Okay.
And there's also been some articles about, okay, if I got the first two and they were Pfizer, is it okay to get the Moderna? The recommendation is try to stay with what you've got, but there is actually support that if you can't get one of the other mRNAs that you've already gotten, that you can get the one that, if you got a Moderna, you can get the Pfizer, but try to stay within the same category that you were already in.
Okay.
And I'm not 100% sure that we're doing public vaccines right now, because we're really trying to get our caregivers through it right now at the hospital itself.
Okay.
I may be wrong. And for ours, even for our own caregivers, you have to call ahead and make an appointment. So you can't just walk up to where we're doing the vaccine.
Well, a lot of people, like me, they think of something, they're like, okay, I need to go and do this, and now's the time I can go and do it. So it's good to know at least that some of these pharmacies are allowing that, and it still would be advisable, obviously, to call ahead. But at least that way you have that option of, I don't have to wait for somebody to call me back, and then I've got to find another way to get there.
On a personal note, I know when on the occasion that I go into Walmart and do some shopping, I hear them announce it periodically overhead that they are offering COVID vaccine, and just stop by the pharmacy to get your shot. So
Okay.
I think it is just that easy at a lot of our local pharmacies.
I'm going to have one more question on this particular item because it comes up often. In regards to my ability, or if I am vaccinated and the virus still comes into my body, do I still shed virus? I mean, am I still potential there that I could infect other people even though I am vaccinated?
Yeah. Again, we go back to it's a relative risk. The answer is yes. There's a possibility that could happen. How long that would continue and to what extent it would happen is greatly reduced if you've been vaccinated. And that's, again, why the mask request or the mask mandate in public areas is out, so that if you are shedding, especially if you're asymptomatic and shedding, you're not infecting other people. But again, your risk of that is greatly reduced if you've been vaccinated versus having not been vaccinated.
Really good information. I appreciate you both being here and providing this. There's just so many questions out there, and obviously this is a unique experience for all of us. And it's not just a local experience; it's happening everywhere on Earth. And
Right.
so, having some local numbers and some local knowledge and those kind of things is invaluable. And so, I encourage people to continue to follow the Salmon Regional Medical Center Facebook page, website, read it for the New Mexico Department of Health as well. I mean, there's good information on that. Always something on Facebook being shared. We have propped up the Office of Emergency Management again here, San Juan County's office. That staff is working. We also have the COVID shelter operations that are back in play again. So everybody's back. We're having stakeholder calls. We're all paying attention to this. And I certainly, what always impressed me about all the entities here in San Juan County is how well we work together. And it's very rare that we find any type of butting of heads, because we're literally trying to row in the same direction. And I think that's been very evident certainly throughout these last 20 months or so.
Great.
So thank you for the part that you all have played in your organizations as well.
Yeah, it's definitely been a great team to collaborate with,
has.
and really appreciate everyone who's been involved. So, hopefully we don't have to do this for much longer, but at least if we do, we're
Yeah.
a great company.
No,
So.
it's a great team effort across the entirety of the county, and I'm proud of the team across the board. Our team at the hospital, as well as the interactions that we have across the board.
And I think we've asked some hard questions of decisions that are being made at different levels of government. In this corner of New Mexico, I believe we've asked some really good questions, and we need to continue to provide that feedback and be a spokesperson for our community. And
Right.
because it's the novel coronavirus. Novel means new, and we're learning new things all the time about it. And as much as we want it to go away, it continues to find ways to, I don't want to say surprise us, but certainly it's not leaving right now. But
Right.
we'll work through this.
We will.
Yeah.
Definitely.
So for all of you out there, we just continue to encourage you. Seek out information on what's happening here locally. If you're feeling ill, as the doctor and Rita both spoke about, please make sure you reach out to your primary care physician. Get some information on them on what next steps should be. Lots of great places, if you're feeling like you need to get tested, that are offering those free tests. And we, again, encourage our local healthcare professionals, teachers, state workers, city workers. I mean, I know that testing is, it takes time to go do it, but we need you. The community needs you that you serve. So please just doing a great job and know that we've got your back. So thanks again for being here, and
Thank
I'm
you.
sure
Thank
we'll
you.
have you on again.
Indeed.
All right.
Thanks.
Thanks for tuning in to the Mayor's Table. We'll see you here next time.